It's coronavirus today, 507, phase 3, day 17. And it's the fourth day of over 200 cases, but we're at 218 cases, so that's lower than 40 lower than yesterday's actually. So 40 cases are from Toronto, so Toronto's still in the lead. Okay. As usual, so 33 is from Pure Region, 23 is from York Region, as usual. 16 from London-Middlesex Region, 14 from Hamilton, 13 from Durham Region, and 12 from Waterloo Region. All other regions are reported under 10 cases. Two deaths have been reported. Variant cases have been finally updated, and UK variants are at 145,531. Which has not been updated since 3 days ago. 3 or 4 together. South African variants is at 1493, which is a 1 up since last time. Like the last 4 days. Brazilian variants are at 5,163. Which is just basically 21 jump higher, and India variant is India variant apparently at 4,802. Which is a big increase since last time, actually. Now when, So still the usual UK variants, Brazilian variants, and India variants are dangerously increasing, with the India variants surpassing the South African variants, and soon to pass the Brazilian variants, and soon to be number 1, which is not good news. So vaccines are like, and phase 3 and 4 information are still down below. Okay. So what I want to talk about right now is the Moderna vaccine, and the Ontario pharmacist group says provinces in a critical period is to use Moderna shots with, and So Ontario pharmacists said thousands of doses of the Moderna vaccine are set to expire soon, and they warn the supply could go to waste if the people don't show up to get a Moderna vaccine shot. So the CEO of the Ontario Pharmacists Association said some of it, Moderna shots are they can expire in early August, and generally supplies that arrived in bulk should be used within 30 days, or else it goes bad, like AstraZeneca. So Justin Bates said a slowdown in Ontario's vaccine rollout and public preference to the Pfizer-BioNTech vaccine shot has made it difficult for pharmacists to use the Moderna doses. I mean, I got the Pfizer-BioNTech vaccine, not by choice, but yeah. And I checked my vaccine receipt, and apparently I got the same vaccine again. I got the Pfizer-BioNTech vaccine, like right here. So I didn't mind if I if I got the Moderna vaccine. If they wanted to, they could have. You know, that's up to the people who vaccinate people. And he said, Justin Bates said, it's an awful situation for the pharmacists to be in. They've done everything they can be to make sure there's no wastage, but they're yet coming to the place where they may have to, or already have to, you know, throw it out. So this is happened right after health unit the London-Middlesex Health Region health unit asked the public to roll up their sleeves for the Moderna vaccine before the more than 21,300 unallocated doses expire in 2 weeks' time. So pharmacies are ordering vaccines based on scheduled appointments to cut down possible waste, according to Justin Bates. But they still need to use the supply they have on hand. So you got Pfizer, BioNTech. You got to use that. You got Moderna. You got that. You can use that. You got AstraZeneca. Use that. So it's being pharmacists are like technically to use vaccines, the larger dose of vaccine that they have on hand. The vials include enough for 14 shots, and once the vial is punctured, all the vaccines must be used within 12 hours. And if a patient cancels their appointment or Moderna shot, it can't be filled by the end of the day. However, this is not limited to pharmacies and London-Middlesex Health Unit, as they said. They issued a call to residents to take the Moderna vaccine shot because of the 21,000 odd. and they don't and the region's medical officer of health, Dr. Chris Mackey, he said we don't want the vaccine to go to waste. So they're basically asking people who aren't fully vaccinated, like they haven't got their second shot or haven't gotten vaccinated, to try the Moderna vaccine, because it's basically like similar to the hospitalizations. 78 people are hospitalized with coronavirus. Minus 27 from the last 4 days or 5 days that they haven't reported. 110 patients are in ICU, minus 2. Yep. And 79 patients are in ICU. You're using a ventilator, minus 4. So no long-term care home reports, but since the July 29th, apparently. So follow coronavirus safety rules and regulations and phase 3 rules. Don't have gatherings over 25 for the safety of others. It could get worse. Don't if you're signing up for vaccinations, you can try the Moderna vaccine. Doesn't really matter, like Pfizer, BioNTech, or Moderna. Your choice. And also, because of the India variant, you might wanna stay safe. Because if you wanna, stay safe, and ensure that you don't really get affected by the India variant. Because I got vaccinated, so I'm sort of more protected than not protected. So why don't you